Right, so who we are and what we do. Thank you. Local Health Watch are the people's champion for publicly funded health and social care services. We're independent of the NHS and Worcestershire County Council. We listen to people's views about services, and we tell the people who run or pay for services what the public think they could do better and what needs to change. And our purpose is basically to make care better for people. So 2020-21, it's quite a year. COVID-19 changed the way that Health Watch worked in 2021. There was a rapid and radical change to the delivery of health and social care services, and there were new issues and concerns for patients. It was never more important for us to understand people's experience of services and for us to tell decision makers what we found out. The end of the year has been very much overshadowed by the death of Peter Pinfield, our chair. Peter had been with Health Watch since the beginning in 2013, and he brought with him so much knowledge and experience of health and social care services, as well as his outstanding personal qualities of integrity, compassion, and a genuine interest in people. We still miss Peter, but we are looking to the future and intend to build on his foundations and ensure that we continue to champion the voice of patients and carers across Worcestershire. Thank you. So the next slide, please. Thank you. So this is basically what Local Health Watch do. We listen to people who use health and care services. We've not been able to meet with people face to face so easily during 2021 for obvious reasons due to COVID, but we have had contact with over 700 people using video conferencing. We've increased our website with over 10,000 visits, and Twitter and Facebook also have extended our reach. We've held our public board meetings online, and we can watch them afterwards on our website or on our YouTube channel. In fact, we held our first public board meeting on the 25th of January 2020, and we were quite proud of that, though we have learned a lot since then. We also held an online NHS question time for local healthcare and leaders so that people could ask questions about local services and hold them to account. However, and it is a very big however, we know that there are people, not everyone wants to or can use the internet. So we've been actively reaching out to local communities, including through our reference and engagement group, which is a local network of 100 organisations and patients by experience, and to help us gather people's views. We also produce bulletins and write an article bi-weekly, every 2 weeks in the Worcester Evening News, and have been on local radio. We've made a special effort to reach out to children and young people through schools and colleges in our relationship with Worcestershire University. Through older people, people from ethnic minority communities, faith communities, lesbian, gay, bisexual, transgender plus communities, people with learning disabilities with support from Speak Easy Now, Our Way, Where Next, and people with mental health issues and carers. The next thing that we do is our role is to help improve the quality of health and social care services. So we do this. What people have told us, and have told us for a long time, is that patient safety and high quality health and social care services are really important. And we check this by asking for assurances about services, including the use of respect and resuscitate forms for people with learning disabilities, and meeting demand for mental health services and plans to support care homes during the pandemic. We have regular meetings with the Care Quality Commission and contribute to the Care Quality Commission's identifying and responding to closed cultures guidance for inspectors. We attend and provide information to the County Council, the committees which look at health services and social care services for adults, children and young people. And we comment on the quality accounts of health providers. And we check how patients are kept safe and that any concerns are dealt with through feedback to and formal meetings with Worcestershire Acute Hospitals and Healthcare NHS Trusts and the clinical commissioning groups. We also make reports and recommendations. So we also do more in-depth research on issues that are brought to our attention by the public and also by changes of services. Some of the projects that we had planned for 2021, we were unable to carry out due to COVID-19 restrictions and the exceptional pressure that the health service was under. However, we have gathered over 3,160 experiences from patients, service users and carers And we have also sent in views to 3 local and national consultations. All of our reports and the responses to them are available on our website. So in early 2020, we focused very much on finding out people's experience of health and social care services during the first wave of the pandemic. We had over 2,400 responses to our survey, and we provided the NHS and Worcestershire County Council with quick spotlight reports so they could rapidly act on our findings. And we gathered the experience of people with learning disability and autism through an easy read survey. And we made recommendations to the NHS and to the County Council about information support, access to services, and mental health and well-being. We also ran a survey for young people aged 13 to 19 about the impact of the pandemic on their emotional well-being and mental health. We found out how they wanted to access information and support and their experiences of using support. We also ran a survey about accessing dental services, which has been an issue during the pandemic, and shared the results with NHS England. We also have every month a Tell Us About topic where we ask people to tell us about services, including dentists, GP practices, COVID-19 testing, hospital outpatients, mental health services, and NHS 111. And we have also launched a survey, which we almost finished, but we have fed back about it, about understanding people's concerns about the COVID-19 vaccine. We also did a report, which we're waiting for a response to, on service user and care experience of the South Worcestershire Community Assessment and Recovery Service. And the feedback from that suggests that more needs to be done to ensure that patients and carers, they have care plans and are kept informed. And as a result of a report that we actually published in March 2020 on LGBT+ experience of health and social care services, organisations have made commitments to improve their data capture in relation to gender and sexual orientation. And the County Council is also asking providers to demonstrate how their service is supportive of LGBT+. Another function that we have as Healthwatch is to make sure people are involved in planning and reviewing services. So we have continued to support local people's involvement in services. We distribute local and national surveys, highlight consultations and opportunities to feedback about service, and we encourage people to take part. For an example of this, in specialist cancer services, in future, patients may need to travel to larger centres for more specialised cancer care. And you told us that you wanted to see services delivered locally wherever possible, and that the location of specialist centres should take into account the existing public transport network. So the Worcestershire Acute Hospitals Trust took our views and these factors into account and decided to partner with University Hospitals Birmingham for specialist cancer services. Also, our Healthwatch representatives use our work to make evidence-based contributions to the Health and Wellbeing Board. We also have a signposting function as part of Local Healthwatch. And last year, over 360 people contacted us to share their experiences and for help and information about local health and social care services. We signpost people to the right information and organisation. And we also have produced a guide in different formats about how to complain about health and social care services. The final thing, I suppose, that we do in this is that Healthwatch, we are part of a larger network, so Healthwatch Worcestershire, but then Healthwatch England is the national organisation and they feed in at national level. They provide us with information and advice, but our local Healthwatch information about health and social care services also informs them and helps Healthwatch England to build the national picture. We engage with Healthwatch England by attending the West Midlands Network meeting and by also representing the West Midlands Healthwatch Network on the West Midlands Cancer Alliance, which reviews the clinical pathways for all cancer services. Could I have the next slide, please, Morag? Thank you. So in 2021, Worcestershire County Council paid us under contract to deliver local Healthwatch services. And they paid us £260,822. The main areas of expenditure have been staff costs of £218,328, establishment costs including depreciation the 43,920, and engagement costs of 5,050. This left us with a small deficit of 6,475 for the year, which was a planned deficit and was funded from reserves. We're pleased to say that our contract has now been extended for a further 2 years and to March 2023. And finally, the last thing I would like to mention about our annual report is to thank our volunteers, including our co-opted board members. Throughout the pandemic, our volunteers have continued to play an important role in support of our work. They help us with our survey development, report writing, and providing feedback to the NHS on draft patient information. And we are very grateful to their support. I would like to take this opportunity to thank them all. And finally, what I would like to say is to please get in touch, because your voice really does matter. We are nothing without the public and patients and carers who feed back to us. Thank you very much. Okay. So, thank you. I'd like to now